So it's a little rich to me that the Conservatives' chief argument against this program is there's confusion and misinformation when they are the originators in chief of that misinformation, right? What's confusing about it?
On things like free dental care.
Get free dental care?
Dental care program that will ensure that their visits will be free.
To access free dental care.
This is not free dental care.
Yeah, that's absolutely true, David. It's not a free program.
Mark. Boy, has it been a while since we've seen you. And let me tell you, this man does not disappoint, as today he came out with some sort of an update in regards to the Canadian dental plan that they've rolled out in the past few months. And as you saw from the opener there, the media kind of pounces on him in regards to this whole free situation. So without further ado, let's get into the first question.
Rachel Ayalo, CTV News. There have been examples of providers talking about instances where patients have learned that they might not have full coverage or the entire dental care program might not be quite free. So as this program continues to expand, does the government need to do more to improve the communication around this so patients going ahead know what they are and aren't going to get covered?
Yeah, it's a totally fair question. And I think that, Rachel, there are folks getting care all across the country that's deeply affordable. But it's not always free. There are some instances where there's a difference between the fees, the fee guide that we have and the fees that the professional is charging. So there can be a differential there. So I've been very clear throughout my time as minister that difference exists. It's called equal billing, and it's important that people understand that. And for the 450,000 people who've gotten care, they've been able to go in, have that conversation. They get an estimate of what the work is and what is covered. And in the vast preponderance, it is covered. It makes it deeply affordable.
Yes, it makes it vastly affordable, but only for a certain subset of individuals. As back in March, when articles like this were coming out about it not being free and that 90% of the dentists and PEI would not sign up for it, they made the claim, when the Prime Minister or the Minister of Health or NDP leader Jagmeet Singh stand up and tell seniors in particular that you are now eligible to apply for this plan and your treatment will be free, as you heard from the opening clips then, right off the bat, that causes a major problem for all dental offices, which is piggybacking off the question from the reporter. However, the main thing is this is not true depending on your income level, where it says seniors with household incomes above 90 grand a year are not eligible for the program. And for seniors whose incomes are between 70 to 90, there is a copay option, which is further explained a little bit when you look at the misconceptions about this dental plan, where it says, for many patients, treatment under the Canada Dental Care Plan will not be free. Many people are under the impressions that under this plan will cover all of the costs of their care. This is not the case. In many cases, the coverage provided by the federal government under this plan is less than the usual dental service fees. Patients will be responsible to cover the difference. In addition, a patient's family income may reduce the amount of federal government's pay. So again, not only is it not free, but the coverage that you are allotted is all dependent on your income, which you have to disclose to get enrolled into this plan, which seems a little strange to me. And the Conservatives have been a huge critic of this, as the follow-up question now is about what the Conservatives said in regards to this plan.
Hi, Minister Holland. Marina von Stackelberg with CBC News. The Conservatives have put out a release about the dental care plan this morning, calling it a program riddled with chaos, backlogs, red tape, and higher costs. They do point to a survey, an online survey that the Canadian Dental Association did, which showed that nearly half of seniors that they surveyed felt that there was miscommunications, confusion over how the plan worked. So what is your response to what the Conservatives have to say here?
Well, Marina, it's rich, right? The Conservatives saying, there's confusion about this program. There's chaos about the only chaos of the program is from the Conservatives, right? The Conservatives saying there are all these problems. I've just listened to what you just asked me. And put that against the reality of what I just said. This is the largest federal program ever launched. In 3 months, 450,000 people have got care. To put that in stark terms, that's 450,000 people who did not have access to care before. This is people who have teeth in their mouth as a result of this program existing.
And hey, those are some fantastic numbers. Yet again, they were under the misconception that this would be free, as you guys stated this over and over again. And the Conservatives did say that in a statement provided by the party spokesman, Stephen Ellis, who is, I believe he's a doctor as well as an MP, wrote to the Liberal government has botched the program from the start. While the vast majority of Canadians don't even qualify for this program, those who do may still have to pay out of pocket. Canadian households that make between $70,000 to $90,000 allow clinics to bill patients additional costs, and the plan doesn't cover it. This disastrous dental plan is riddled with chaos, backlogs, red tape, and higher costs, and the Liberals, as always, expect Canadians to thank them for it. Their wacko Minister of Health is trying to distract from their disaster by telling Canadians they never had it so good. And the program actually is hyperlinked here. And when you check out the what services are covered, it says how much will be covered. The plan will reimburse a portion of the cost of your treatment, but it may not pay the full amount. Again, separate from what they kept saying, free, free, free. You may have to pay additional charges directly to the oral health provider if, and this is where it said in the previous article, your adjusted family net income is between $70,000 and $90,000. And when you scroll down more, it breaks it down into these co-payments of less than $70,000, $70,000 to $80,000, and $80,000 to $90,000. And then it also kind of gives you a little example if you didn't have a co-payment, if you did have to pay 40% and 60%, which all correlate with this. So again, very misleading, as you saw from the opening videos. They all claimed that this was free, 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 and it's just weird that Mark's saying, well, where's the confusion? Where's the confusion? There's the confusion. That's why the Conservatives are pressing you and saying what they're saying. And Mark decides to leave this little tidbit for the Conservatives in regards to the election.
I think if the Conservatives want to win the next election, they should have the best ideas. If they want to win the next election, they should show how they're going to make the country better than we're making the country. But trying to set fire to things that are working because they're afraid politically it's going to be bad news for them, I just think that's, well, frankly, disgusting.
I am really curious as to what kind of drugs this guy's on, because he actually made the statements that the Conservatives need to show how they would make the country better than the Liberals have. What have you guys actually done? You have ruined the country. Nothing is affordable. Housing, groceries. That's why you constantly have to keep making all these stupid plans and policies, because you want to give the illusion that people can now afford things, when in reality, if we just had better paychecks, kept more of our money, then we would be in a better position. But as always, this is just my opinion. I'd love to hear from you guys. What do you think about what Mark said and all this craziness? Let me know in the comment section below. Don't forget to hit the subscribe button and the like button. It really does help the channel reach other people and grow, so I do appreciate that. And as always, I will catch you guys on the next one. Thanks so much.